The UK is in the middle of a COVID crisis, and as a junior doctor, I'm struggling to sit in the middle of it, knowing the history behind what has happened to us over the last few weeks. I struggle to see how we've managed to get to this point when we've had such a significant warning from other countries and from history itself about what was going to happen. So I am going to break down exactly what the evidence is, what the timeline has been, how much warning we've had coming up to this point, and why the government should and still can act to prevent some of the damage that COVID may potentially do. Looking back, it's very difficult to understand our present situation without seeing the history behind where we are. Now, many of you know that the SARS virus rampaged across Asia around the 2003 period. It was known at that time that the reservoir for the virus was in bats, and these also came from wet markets. Now, back in 2003, the SARS virus came out of nowhere, and it triggered a significant amount of research and funding into academia. About 4,000 papers were published about SARS, and of those, there was one specific one which was very significant. It was talking about how fast the coronavirus remodels and changes itself, and the fact that the virus has a reservoir in bats, coupled with the live animal eating practices in southern China, was a ticking time bomb for reinfection. You can see the paper here. So this should have been enough warning. Now, unfortunately for the western side of the planet, they weren't really affected by the SARS virus. At that time in 2003, you might sit there thinking, why is he saying that it was unfortunate for us not to be affected by the virus? Surely being unaffected by a virus is a good thing. Well, yes, you're right, but not when you get hit by a stronger virus, which you are unprepared for, wholly and truly unprepared for. Now, let's step forward into the present day, away from 2003. Now we are in a time where we have a highly infectious virus that has a significant mortality rate. When did we first find out about this? In China, there were reports of a new kind of pneumonia at the end of December 2019. We are in March now. That was 4 months ago. And this pneumonia eventually was tested by Chinese scientists and found to be a new type of coronavirus. The report of all of the Chinese experience and warning that this will become a global concern was published in The Lancet, which is a very popular English medical journal, on the 24th of January this year by Dr. Wang and his colleagues. They warned that knowing the SARS virus background in 2003 was of such a damaging scale in Asia that this virus could potentially be even more catastrophic because of the lack of infection control practices that had happened in the previous pandemic and will undoubtedly happen during this pandemic, and because the mortality rate in some groups reached up to 14 or 15%. That in itself, I can understand why we did not take too much heed. If you think about it, we are quite far removed from China. There's a lot of things that we hear about day to day, and they sound worrying, but you don't know if they'll actually affect us. Only looking back do we know that this is something that we needed to worry about. So fair enough, I can understand we did not get too concerned at that point. So let's look forward. Things started coming closer to home in the UK when Italy started developing its first cases around January the 30th and decided to block all flights from China at that point. Now, the cases started to increase, particularly around Lombardy and the surrounding areas. And with their exponential growth, the Italian government decided to initially close part of the country and then the entire country on March the 9th. Okay? I'm recording this video on March 29th. So we are quite far out from that. Now, on the 10th of March, just one day after Italy completely closed its country, there was modeling published by a guy named Thomas Pueyo, who does some statistics and did a very nice analysis tracking what the number of cases were amongst different countries in Europe. And he showed that we were just 2 weeks behind Italy and that our caseload was doubling every day amongst others. 10th of March. Okay. Moving forward, on the 12th of March, our government announced that the strategy that we were using was one of herd immunity, which means we were going to try and get as much resistance to the disease in the general population as possible to protect those who are most at risk of complications. This is usually a strategy in medicine which is used for diseases that have vaccines. There is no vaccine for the novel coronavirus. The only way to gain immunity is by becoming infected. The problem with that strategy is that being infected by a deadly virus to gain immunity means you have to be infected by a deadly virus. That's the point. Yes, over the hump, after a while, you will get the herd immunity effect, but you are not avoiding the problem by making millions of people contract this deadly virus. So, just 2 days after the UK released this statement that this was their strategy, a letter was released by a group of academics and signed by over 500 worldwide, mainly in the UK, aimed at the government to say that we disagree with your strategy completely and you need to enforce, just as Dr. Wang said in his initial paper published on the January the 24th, infection control measures which are sufficient to slow the spread of the disease. That was on the 14th of March. Now, we bumbled, we fumbled, and only on the 21st of March, where after you think that cases are doubling at least every day, probably more than that, did we impose a complete ban on unnecessary movement. Now, that being said, we're still not to the same degree as some of the Asian countries which initially had to deal with the virus. China had much stricter controls than we currently have even. I know it feels as though we are imprisoned between our own four walls, but one must look back and think, why, when other countries around Asia are geographically closer to the source, one, were infected earlier, two, are they still not experiencing the same level of spread that we are experiencing here? If you look at this model, which again was published by Thomas Pueyo, you'll see that South Korea, for example, Japan, for example, Thailand, for example, all do not follow exponential curves in the rate of spread of the disease. Why is that? It is because of the measures, of the controls that they are using to stop the spread of the disease. They have experience. They have learned from the 2003 SARS epidemic, and they are limiting the spread of this pandemic. China last week closed its last temporary hospital and is now back in production. Its factories are open, its people are working. And here in the UK, we have stopped completely. Everything is deadlocked. With them being the epicenter of this, you have to think they must be doing something right. I know that the evidence is conflicting, and I know that this is a new virus and we need to take a long time to learn about it. But I fail to see how this government has completely ignored the numbers and the evidence to the point where someone of the public, in fact, many members of the public have seen this data and have analyzed it. And yet the people who are producing our policy are not acting in the way that keeps as many people as possible safe. Now, looking back, the COVID-19 response group based at Imperial published a paper on the 26th of March saying that if COVID have been allowed to spread unrestricted, then 40 million people worldwide would have died. By ensuring that extreme social distancing measures are adhered to, that number goes from 40 million down to 2 million worldwide. That is 20 times less people who die. That is a significant amount of people that could be saved by these measures if they are imposed early enough. Now, the government's initial response to their criticism when they released their herd immunity strategy on the 12th of March was that they don't want to impose strict sanctions on people because they're worried that they'll have to put these restrictions on them for too long and people are going to get sick and they're going to stop listening. Well, that's just not good enough. You need to enforce what saves the majority of people, and you need to explain why things are being done. If people do not follow that, then that's fair enough, but that cannot be a reason why you don't take measures to save a significant amount of people's lives. It's just absolutely unacceptable that that was even mentioned as an excuse. And also, it has been shown by modeling even with the previous SARS viruses, that you can limit the amount of time that people spend in isolation if you start to enforce social distancing earlier, because that means that less people are infected and there's less transmission during the isolation stages. Yep, a lot of this evidence potentially can be argued, but it's very difficult to ignore the overwhelming facts that people are presented with. So I think looking back, the government have managed this very poorly. As a doctor on the NHS front line, if you will, I still have to go to work when everyone else is at home. I've been dealing with suspected COVID patients. I feel as though the messages coming from central government are that we are going to try and fight this as best as we can. But there's been a lot of silence around the finer details of how exactly that's going to happen. I think they say a lot of things that sound good, but we have not been given much guidance at all. It has been down to us. We've had to research how to manage this rather than be told by central government exactly what the strategy should be nationwide. Not only that, but there have been situations where nurses who've been looking after suspected COVID patients have not been prioritized to make sure that their protective equipment works the way that it should. And we've been in situations where our alcohol hand gel has been stolen by members of the public. Our masks have been stolen, and we've been left with suboptimal protection against this deadly disease. If you do not look after the people on the ground and you do not test them, even though the technology to test them is available, then you will not have a workforce to fight this battle against COVID, because that's what it is. We are now worse than at war. And hopefully that will start to make sense soon. I do not understand why doctors, nurses who have symptoms of COVID are not being tested and are isolating themselves for 7 days. They do not know whether or not they have the disease. And so if they go back to work and they start developing a temperature again, then that is another frontline member that you've lost again for another 7 days without knowing if they actually have COVID or not. Why has there been no testing? It's beyond me. So just to summarize, I think the way that the government has dealt with this overall, both with policy and with healthcare management, has been a scandal. And there could have been a lot more to help save lives done earlier. And even now, we can go further to limit the spread of the disease. Seeing that there are completely packed tube stations still after the country is supposed to have been shut down is, again, really difficult to see, knowing the amount of danger that those people are putting not only themselves but the other people around them in. Anyways, that is my 2 cents on the situation. What do you think? Give me a comment below. Share it if you felt that this is helpful to actually make sense of what has happened so far, and maybe we can get restrictions placed which go even further to protect the people. And stay healthy and stay happy as best as you can in this situation. And I will see you later. Peace out.